When I treat patients for Peyronie's disease, I use a multimodal approach. I tell patients there are 4 options. There are certain medications that we could potentially use. There are stretching devices. There's now one FDA-approved treatment option, which is collagenase or Xiaflex, and then there's surgery. Each patient is unique and different, and it really depends on what their goals are and how far they want to go along this process.
Peyronie's disease is a very complex condition that requires different treatment strategies according to the disease phase. For those in early stages of the acute phase of Peyronie's disease, I recommend penile traction, which aims to stretch the penis and prevent further bending or shortening. For those in chronic and stable disease who are having difficulties to have satisfactory sex life, I recommend surgery. Surgery may vary from more simple placation procedures to implantation of penile prosthesis. Intralesional therapy with collagenase is unfortunately not available in South America, but is also another option in other parts of the world.
Well, Peyronie's disease, unfortunately, has been around for 500 years and we still don't know the cause of it. And therefore, the treatment is quite difficult. There are treatments for Peyronie's disease, and in the early stages, all different physicians have different choices for you. I tend to use mechanical therapy, such as a vacuum device or one of these penile stretchers. The Restorex stretcher is a very nice stretcher here in the United States. If they've got pain, you can take simple analgesia. We've done a lot of research on some medications such as tamoxifen and tadalafil to try and prevent progression of the condition. By and large, I think the mechanical therapy in the early stages is important to try and stretch the penis and try and limit the amount of curvature. Rest assured, the pain will go on its own, usually 3 to 6 months or so. And very rarely, if you have a curvature, then of course there's a surgical option as well. But nothing happens for the first year, so self-help, stretching, perhaps some medications from your doctor, and only less than 10% will end up with an operation.